Welcome to today's video, where we'll explore the 10 warning signs of stroke in women. Did you know that every 40 seconds, someone in the United States experiences a stroke? But what exactly is a stroke? And why is it so crucial to spot the signs early? A stroke happens when the brain's blood supply is interrupted, depriving cells of oxygen. There are two main types: ischemic, caused by a blockage in an artery, and hemorrhagic, caused by bleeding in the brain. Both can lead to severe consequences, such as loss of movement, speech, and, if untreated, life itself. Women are particularly vulnerable, and their symptoms can be more subtle, making early recognition vital. Spotting even minor changes can be life-saving. Today, we'll cover these signs and discuss how to prevent and respond to a stroke to protect yourself and loved ones. Symptom 1. Sudden numbness. Sudden numbness or weakness on one side of the body, especially in the face, arm, or leg, can be an early indicator of a stroke. This usually occurs when a stroke affects areas of the brain that control muscle movements and sensation. Women may experience this symptom more intensely due to hormonal factors. To quickly assess for this, ask them to lift both arms. If one drifts downward, seek emergency medical care immediately. Symptom 2. Mental confusion. Sudden confusion, difficulty speaking or understanding language, can be a key sign of a stroke. This occurs when blood flow to brain regions responsible for language is disrupted. Women might show subtler signs, such as having trouble following a conversation or struggling to find words. To check, ask the person to repeat a simple sentence like, "The sky is blue." If they have difficulty, it could be an early stroke symptom. Symptom 3. Vision problems. Abrupt changes in vision, like blurred or double vision, or sudden blindness in one or both eyes, can indicate a stroke. These symptoms arise when blood flow is cut off to parts of the brain responsible for vision. If you notice these changes, whether it's difficulty focusing or sudden vision loss, treat them as potential stroke symptoms and seek medical attention right away. Symptom 4. Dizziness or loss of balance. Experiencing sudden dizziness or a loss of balance can severely impact your ability to perform everyday activities. These symptoms can occur when a stroke affects the cerebellum or brainstem, which control balance and coordination. Test your balance by trying to stand on one foot or walk in a straight line. If these tasks are unusually difficult, it could be a sign of stroke. Symptom 5. Severe headache with no known cause. A sudden, severe headache that appears without any clear reason can signal a cerebral hemorrhage, a type of stroke caused by bleeding in the brain. This can lead to intense, debilitating pain, often described as a thunderclap headache. If you or someone else experiences a sudden, intense headache that feels different from usual, seek immediate medical attention. Symptom 6. Sudden trouble with walking. Difficulty walking, suddenly needing support to stay upright, or feeling as though the room is spinning could signal a stroke. This happens when a stroke affects the parts of the brain responsible for motor control and spatial orientation. Watch for signs like an unsteady gait or sudden clumsiness, and take them seriously. Symptom 7. Unexplained fatigue. Sudden, overwhelming fatigue that doesn't improve with rest can be an important, but often overlooked, sign of a stroke in women. If this fatigue is so severe that it affects daily function, it's time to seek medical advice. Symptom 8. Face drooping, or an asymmetrical smile. An uneven smile or drooping face can be a serious sign of stroke, caused by damage to the brain's motor cortex. To check for this, ask the person to smile and see if one side of the face is lower than the other. If you notice asymmetry, seek medical help immediately. Symptom 9. Sudden nausea or vomiting. Unexpected nausea or vomiting without an obvious cause, like food poisoning, can also indicate a stroke. This happens when the part of the brain that controls the digestive system is affected. These symptoms can be misleading, so awareness is crucial. Symptom 10. Brief loss of consciousness. Sudden fainting or a brief loss of consciousness, known as syncope, can be a serious warning of a stroke. This occurs when blood flow to the brain is temporarily interrupted, leading to a blackout. If you or someone else faints without explanation, seek emergency care immediately. Remember, recognizing these symptoms quickly can be the difference between life and death. Be fast is a quick way to remember the warning signs of a stroke. Balance. Sudden loss of balance or coordination. Eyes. Sudden trouble seeing in one or both eyes. Face. Face drooping on one side, especially when smiling. Arms. Weakness or numbness in one arm. Check if one arm drifts downward when both arms are raised. Speech. Difficulty speaking, slurred speech, or trouble understanding. Time. Time is critical. Call 911 immediately if any of these symptoms appear. If you or someone around you is showing signs of a stroke, it's crucial to call an ambulance immediately. Don't try to drive yourself or someone else to the hospital. Emergency medical services can start life-saving treatment as soon as they arrive and get you to the right facility faster. It's also important to understand the concept of a transient ischemic attack, or TIA, often called a mini-stroke. While the symptoms of a TIA may disappear within minutes or hours, they are a serious warning sign that a full stroke could be on the way. Don't ignore these symptoms just because they seem to go away. Seek medical help right away. Your health and the health of those around you is too important to take risks.